Sure. Dulse over Kelp. Well, the story with that was we had patients coming into the clinic who had thyroid issues, and they were being told to take Kelp because at the time, frankly, very, very few people knew about sea vegetables in general. And so Kelp had become the sea vegetable. Obviously, there are numerous other types of sea vegetables, but from a marketing sales standpoint, Kelp was the one. It was a green plant. It was easily noticeable. And so patients were taking this in trying to help with the thyroid issues. What we were finding was that they were having some difficulty in some of the cases. It's almost like their metabolism was being slowed by the Kelp, even though it contained all of the prerequisite nutrients and iodine that was supposed to be helping with the thyroid issues. And so because of that, we were playing with some different plants, and a lot of people like to eat sea vegetables, but they didn't necessarily care for either the preparation and the cooking of Kelp or the taste of it. And so we had switched over to Dulse, which was a comparable nutrient profile to the Kelp, and that just seemed to do the trick. Now, the interesting thing about that was that later the labs started coming back, and the Dulse patients were doing a lot better than the Kelp patients. Now, initially, you're not really thinking too much about it until it just keeps happening and keeps happening and keeps happening. And so we decided to test it out. And so patients who'd be taking Dulse, and then we'd be watching their labs versus the patients who were taking Kelp and watching their labs. And sure enough, for whatever reason, at least anecdotally in my clinic, the patients who were doing the Dulse were doing better than the patients who did the Kelp. Now, there can be a lot of variables at play with something like that, but over time, and I'm talking, close to 15 years, where we would see over and over and over again that the Dulse decidedly worked better. Now, people may have their different perceptions as to why that might be. Frankly, I think that Dulse is a more activating plant. It's a reddish purple plant, and Kelp is a green plant. And aside from the fact that Kelp can get much, much larger than Dulse gets, it can be hundreds of feet long. And so this may have some bearing on the method or the reason as to why the Dulse might work better. But from an anecdotal standpoint, that is why I always favor the Dulse over the Kelp. You always look at each situation individually. And so there have been patients where I thought they would do better with Kelp than they would with Dulse. And there's very specific reasons for that. But by and large, we use Dulse for just about all of those situations, not always as a main source of treatment, nutrition, but sometimes as an adjunct for getting a well-balanced blend of trace minerals and a wide cross-section or a broad spectrum of trace minerals, and of course some iodine. That's one of the other differences, is that the Dulse is lower in iodine than the Kelp is. Not that that should be a reason. Nobody really knows, I think, at this point as to why the balance of nutrients in the Dulse may be better than Kelp. Or is it just those are the types of patients that I would get? But it became obvious that the Dulse was working better than the Kelp, at least anecdotally and through all the labs and patient success stories. So that's, to answer your question, primarily why I favor the Dulse over the Kelp at this point.